This is Parasitology Seminar for December 3rd, 2020. Wichita Falls, Texas, a COVID-19 case study. So you might wonder why a University of Nebraska seminar would be focusing on Wichita Falls, Texas. There are a couple of reasons. The first one being that I had step-parents in Wichita Falls. My mother died in 1962 at the age of 49, and a year later my father married his insurance agent, Rachel, the woman on the right. And she had never been married and had no children, so our own children, she was really the only paternal grandmother that our children ever knew. Well, 10 years later my father died, and this was all in Oklahoma City. So Rachel lived and worked in Oklahoma City for the next decade plus a couple of years, and then she got reacquainted with Sam Bristow, the gentleman on the left. Sam was a petroleum engineer who lived and worked in Wichita Falls, Texas, and he and my father had known one another through the oil business, and in fact Sam and his wife, then deceased, or now deceased, had played bridge and maybe even played golf with Rachel and my dad. So Sam knew Rachel, and they got together and were married in the late 80s. And so now, and they commuted a little bit between Oklahoma City and Wichita Falls, but finally moved to Wichita Falls. So I had these step-parents, and our children had these step-grandparents who were very intelligent and generous and loving, and so those were really the only grandparents they knew, and they were my step-parents. Well, Rachel died in 2015 at the age of 99, and Sam was in his 90s, so I sort of took over their business and their financial affairs. And in 2019, then Sam moved into assisted living in Wichita Falls, and as a result, I renewed his subscription to the Wichita Falls newspaper, the Times-Record News. And because of that renewal, then I had online access to the newspaper. And once the COVID-19 pandemic started hitting Wichita Falls, then the details of those cases started being published, at least in the online version, first by Clara Kowalik, a reporter. I hope I'm pronouncing her name correctly, and then later by Deanna Watson, who was the editor, and she's now gone on to another job, I think, with USA Today. And Clara has now picked up the reporting, at least her bylines on the latest online stories. But the manner in which the COVID data were presented was truly remarkable, and I've asked around about it of a number of people, and even on social media, whether their local newspapers were reporting it in the same way, and the answer is no. And so the Times-Record News really produced essentially a data set. So early on, and I say early on for them, by the middle of June they really only had 100 and some odd cases. This is what it looked like. So look at case 103, gives the ages and what they're doing and how they evidently picked up the virus. And so this is exactly what appeared. Well, a couple weeks later, the data were beginning to be summarized a little bit, but they were still pretty detailed. So the old biologists looked at this and thought, what we have here is a developing data set, and it's really a pretty remarkable one to be published in a newspaper. Hospitalization cases were reported in terms of their conditions, and so as this report kept being produced day after day, or frequently, then you could sort of follow their conditions and follow their whoever those people were by number. They also published, at least during the early parts of the summer and through much of the summer, the daily age acquisition of new cases. So whatever day I picked this one up, there was a kid under the age of 5 who had picked up the virus, and another one under the age of 10. So this is pretty amazing for a newspaper. Here is a copy of a page directly from their website in early July, and so this is what it looks like. So from looking at this, I thought, well, maybe you should take advantage of what the Times Record News is doing. So I set up a spreadsheet and started entering and coding this data by case. So this is what the codes look like. CZ, close contact, etc., etc., daycare, currently under investigation. And then their status is really what will be fairly important later on. RH is recovering at home, hospitalized, in stable or in critical condition. And if you look at the columns there, the date, case number, age, origin, they also give several columns in which you can follow their status. Here's an example of what that spreadsheet looks like from the 1st of July. Most of these folks were recovering at home, but number 333 in his or her 80s was recovering at home, and then not long after was in the hospital. 334 was recovering at home and entered the hospital later in critical condition. So the spreadsheet eventually got very large. So what I did then was begin to address some questions that are typical of really of any parasitological study. Does age distribution of infection match that of the population as a whole? This is sort of what I would call an elementary, questions 1 and 2. And to a lesser extent, number 3 are really sort of the basic demographic questions you begin to ask relative to disease and disease transmission through a population. Finally, can we learn anything from following some individuals? How much is this pandemic costing Wichita County? And finally, what could the missing data tell us? And there are, of course, missing data, and I'll get back to those in a minute. Well, here is then the distribution of positive cases versus that of the age distribution as a whole in Wichita County. And this was based on data from sometime in September. And so what you can see there sort of by a glance is that those distributions are roughly congruent, but they really are not. So the question then might be, why are we interested in this kind of a data analysis? And I'll come back to that when we start talking a little bit about variations in immune response, or potential ones. So what we're looking at the lower age distribution, those kids are really not out in the community nearly so much as people who are more mobile, teenage drivers, and especially people in the workforce. So where you're seeing the number of, or the ratio, or the percentage that are positive in those age groups in the 20s through the 60s, those are really the workforce of the community. So, do certain age groups display changing infection rates over time? And here's basically what that distribution looks like from mid to late June through the middle of September. And I will say, out of deference to the job involved, that this fall, when it got to be September and October, then the data that were published in the online version began to be summarized in a way that for the old For this purpose of this kind of analysis, they were maybe not quite as useful, but they were useful nevertheless. But it's difficult to kind of make sense of this diagram, so I pulled those age groups out in pairs and made bar graphs. So this is kind of what it looks like, and if you look at the y-axis, there are not very many of those kids picking up this virus over the course of those 3 months. When you get to those that are more mobile in the community, yeah, they're picking up these cases a little high, at quite a bit higher rate. In fact, and it looks like that there's a spike in the 20s, and maybe those are college kids, or you know, when you're in your 20s, you're absolutely invincible, and you're not always convinced that what you really want to do is all that dangerous. Here we have in the 30s and 40s, again, there's a fair number of cases by date, but it looks, at least to the eye, like there's sort of a general rate over the course of this, of acquisition over the course of this time. Fewer in the 50s and 60s, but still they're getting them pretty regularly, and fewer still in the 70s and 80s, but still they're getting fairly regularly. So I did a statistical analysis. I did a correlation between new cases per day and the day, and those correlation coefficients range from about a -3 in the 20s to +3 in the 70s, but the R-squared values are really very, very low. So none of those, your statistical interpretation is that none of the relationships between age group and time are significant. They're all flat lines statistically. So through that time period, June through middle September, whatever factors were at work to distribute those infections through Wichita County early in the pandemic were still at work throughout the next few months. And so, quite frankly, if we had that same kind of detailed data for fall or up through today, you could really try to answer the question of whether those correlation coefficients remained at essentially 0 through the fall, or whether there was some change, significant change, in the rates at which some of those age groups acquired their infections. So does the age distribution of hospitalization match the population age distribution? And so why might we be interested in this kind of a distribution? And the answer, of course, is immunological variation. But what we're seeing there is what you also hear really on social media and read in the newspaper, mainly that the hospitalization cases are, and the death cases also, are mainly the older folks. That one child who was under the age of 6 went into critical care very early, so that was some kind of a special case, and that child was in a special hospital, and I simply do not know whether that individual survived or not. Sometime in July, that distribution looked something like this. So that most of those who were hospitalized were in stable condition, but a few still were in critical condition. 2 or 3 months later, the hospitalization, and I just picked this up from some particular day that was reported in mid-October. Again, the hospitalization folks have they have pushed themselves up, I guess, into the upper age brackets, and a fair number of those folks are in critical condition. And I haven't really followed the number who have been dying, but that's also been reported, and you could get that on the Wichita County Health Department website. What we can get from looking at individual cases, however, is the average number of days in the hospital. And even as you're hearing nowadays, currently really, about the demands and the pressure on the healthcare system, one thing that we're not necessarily hearing about is the average number of days and the range in days of people that actually, how long do they stay in the hospital. So I went back through all of the detailed reporting that was in my spreadsheet, and I picked out 63 cases for which I had decent data. And what that, by decent data, that means that I had a day in which that individual first appeared in the hospitalization record, and then I had several days thereafter in which that individual also appeared. And I know that there are more of those than 63 in the data set, but I figured this was enough for seminar purposes. So some of those folks stay in there for a long time. So one person in his or her 80s is in there for 49 days. One 50-year-old, a person in that 50-59 range, is in there for a couple of months. And so these are rather substantial hospitalizations. But the average hospital stay, just looking at that graph, is almost 2 weeks, at least about a week and a half. And if you've ever been in the hospital, 2 weeks in the hospital is not necessarily one of your favorite times. So can we learn anything from individual cases? Absolutely. 436 was recovering at home. Next thing you know, 2 days later, they're in critical condition at the hospital, and 64 days later, they're in stable condition, and I simply do not know whether that person has gone home now, and we don't know really whether that individual has some long-term health issues. Here's 1214, they're in the 70s, went in critical condition, and 2 or 3 weeks later, that person is stabilized, and 25 days later, still in the hospital, and I don't know whether that person, again, survived or went home, potentially with some long-term issues. So do some convert from critical to stable? Yes. Do some convert from stable to critical? Yes. Do some never convert to stable? Yes. Do some recover and then get released? Well, at least I'm answering yes, but at least they disappear from the hospitalization list. So why might we be interested in all of this kind of information about individual cases? And the answer, of course, is potentially at least immunological. Here's a textbook diagram, typical textbook diagram of the inflammatory cascade, and involves interactions between a number of different cell types and molecules known as cytokines. And so everywhere there's a red star is a place that, in my sort of first reaction, or based on my understanding of this diagram, those are places in which individuals might vary genetically and potentially, I suppose, as a result of their encounters with immunogenic particles throughout their life. But humans, as you well know, are an exceedingly variable species genetically. And you would expect them to vary immunologically the same way they vary in terms of hair color. You all know people who are allergic to poison ivy, and you know people who are not, and that can be traced back to genetic differences, really, in their immunological reactions. You know people who have severe hay fever, and you know people who don't. But I look at this kind of a diagram, and immediately all of those red stars pop up, and you say, these are the places in the immune reaction that human beings are likely to vary for a whole variety of reasons, but including genetic variations, the way they were born. So we might go on then to talk about how much this pandemic is costing Wichita County. And it's not, this is a fairly difficult question, but one that I think we need to begin to address really across the board for all communities. Fortunately, at least for the purposes of this seminar, we have a model, or I have taken a model, from the 1993 outbreak of Cryptosporidium parvum in Milwaukee, Wisconsin. Well, for those of you who are not listening in, who are not parasitologists, Cryptosporidium is a one-celled animal that is an intestinal parasite, and in a normal, by normal I mean a fairly young, healthy individual that is not immune compromised, that infection usually produces a week or two of rather remarkable diarrhea, and then you get over it. And of the people I've known who've done research on Cryptosporidium, they sort of laugh it off and say, yeah, everybody in the lab gets infected, and then they're okay. Cryptosporidium is also a global health problem, and especially for those communities that are impoverished and those populations that don't necessarily have good health or sewage situations, and it's especially a problem with childhood diarrhea and all of the cognitive impact of childhood illness in various parts of the world. However, in 1993, a couple of water system filters broke down in Milwaukee, and 400,000 people at least 400,000 people ended up infected with Cryptosporidium. Well, Milwaukee, this case might be really one of the most, if not the most, thoroughly studied and analyzed disease outbreak in history, and certainly in the United States, because it happened in a very civilized place with a lot of physicians and a lot of attention, and of course it was very dramatic. So here's a table from the paper. It took these authors 10 years to sort of do this, so I'm not able to tell you about Wichita Falls in a few months, but here's really kind of the summary from that Corso et al. Paper. This is in Emerging Infectious Disease, the journal, which is a public access, so you can get this original paper. And if I were a graduate student at Midwestern State University down in Wichita Falls, I might be just jumping all over this this pandemic or this COVID cases, simply because if you can replicate the methodology, you're going to have a stunning master's thesis. So mild and moderate cases, what you're really looking at there in the red rectangles, the red highlights, is the productivity cost of disease in an American city. And I'll kind of come back to that then here in a minute. United Regional is the main hospital there in Wichita Falls, and their website produces a list of about 87 or 88 reasons for being in the hospital, procedures and so forth, and the cost. And so the average of those 87 is about $38,000 per stay, and it depends. Somebody has to pay that. It could be Medicare or health insurance or potentially out of pocket, but that's the average cost of being in the hospital at United Regional. as of November 9th, when I really did this analysis, there were a little over 4,600 cases. There were 597 I estimated that had been hospitalized. I took that by going back to my data set, and I think I had something like 3,900 cases, out of which 474 had been hospitalized over the course of reporting, and extrapolated that up. So on November 9th, this was about the situation. So the total cost then would be about hospitalization alone would be over $22 million, and I estimated the productivity loss then to November 9th of about $3.5 million. So how did I do that? Lost productivity. I took the number of mild and moderate crypto infections and the cost of those, and averaged them going back to the Milwaukee study, and then adjusted that cost for inflation. So every dollar in 1993 is worth about $1.80 in 2020. So I estimated that the average mild to moderate crypto was 474, and severe was 2537. So then I applied that to the number of COVID cases in Wichita Falls as of November 9th, and came up with the productivity loss of about $2 million on mild or recovering at home cases, and then another $1.5 million with hospitalization or severe. So my guess is that is a gross underestimate. I mean, it's likely to be a major underestimate. If you compare that parasitological event in Milwaukee with early November in Wichita Falls, you see that the average number of, or the average dollars per case is over 20 times higher with COVID than it was with that Cryptosporidium outbreak. And Cryptosporidium, will remind you again, is one of the contributing factors to poverty, disease, and cognitive impairment around the world in poverty conditions. When we looked at hospitalizations in Wichita Falls in early November, this is what they looked like. These were the active ones by date. They started peaking then in October, or maybe I should say going up and up and up. A couple of weeks later, they're up even higher. So again, I think just in terms of thinking about hospitalizations from COVID, you think not only about the healthcare workers and the costs, but you also consider the number of days in the hospital and what that hospitalization does to families and to the workforce. Well, what's missing from this data set? And the answer is gender, employment, educational level, political affiliation, religion, which church you go to because they behave differently, and annual income that we know is related to education. And I've picked out these two young women. Some of you will recognize that that's the cover image from one of my Gideon Marshall mystery novels. And those are what the cover designer decided to use to represent the two characters in that novel who murder their bullying, abusive boss at a small liberal arts college by generating fear of disease. And so I thought that they drove his stress level up so high that he eventually succumbed to heart attack and vodka and high blood pressure, and they did away with him. So that's part of the mystery novel. So I thought that was an appropriate picture to go along with it. However, considering all these factors that are missing from the data set, I'm going to digress a little bit, and some of you recognize that picture of Matthew Bullock. In general, what I'm calling the Bullock principle is what I've sort of interpreted from watching him work. And that is, major conceptual contributions come from details that can be discovered only through almost inhuman efforts. Matt is known really among those who know him as the originator of the iron wheel metaphor, and he used parasite life cycles. He happened to be spending a lot of his research efforts on parasites of frogs, and so I've picked out frog lung fluke life cycle as an example of that. This phraseology, the scheme of things, and the way things are, that comes from Douglas Hofstadter, the artificial intelligence guru and mathematician, in his book Metamagical Themas. But for example, a life cycle is a scheme of things, and if you present that in a textbook as fact, then that comes across as the way things are, and the way things are then becomes a belief, and the scheme of, and this is how the scheme of things gets converted into a belief about the way things are. So I think you can kind of see where this is going. What Matt really did with his research is break the iron wheel. He considered this life cycle as an iron wheel, and what he did was essentially demonstrate through his research that those life cycle diagrams are really guides. They're telling you where and how to start looking for the factors that control the movement of infectious agents through populations, and in that way, this iron wheel really becomes a very almost a baroque kind of a broken circle. And so the real question is, what are the avenues for movement of an infectious agent through a population, and what are the constraints on that movement? And particularly if you look at avenues and constraints in a comparative way, then you get to one of the challenging problems in parasitology, and that is the evolution of complex life cycles. So this is why Matt's approach into the iron wheel was a conceptual contribution. What he's telling us is that the way things are really is our island of understanding in the sea of ignorance, and the way things are with continuous study and continuous change should in fact dictate our scheme of things rather than the other way around. So what is the potential value of these missing data, provided they could be obtained and used legally, ethically, and effectively? And for those of you who are in academic research, you know that legally, ethically, and effectively, those are non-trivial matters when you come to personal data to be associated with any of those case numbers. But if you had all those, then you could really begin to address the question of whether there are additional factors that are controlling the spread. You could begin to, ideally at least, devise educational approaches to control of the spread. And you could also develop some, potentially at least, some community teachers. Those people that have respect and have platforms. And that includes ministers and educators and, at least in some cases, some elected officials. If we've learned nothing else from this pandemic, it's that words have power. And we've also learned that scientific illiteracy in high places is a public health hazard. And for those of you who follow me on social media, you've seen this comment many, many times. Scientific illiteracy is a public health hazard. Write it 100 times on the chalkboard. So we're dealing not only with a pandemic, of a viral pandemic, but also an information pandemic known as an infodemic. This is a quote from the Cornell study on information. The most popular misinformation centered on miracle cures, drugs with no proven clinical benefit that are nonetheless touted as effective. Notably, her team also found that the president was the primary individual driver of misinformation, showing up in nearly 40% of those misleading articles. And the biggest spikes in misinformation came from when he made pronouncements about COVID-19 remedies. Scientific illiteracy is a public health hazard. Write it 100 times on the chalkboard. Well, what has not been part of the community conversation, and that is the global implications. That's true not only of Wichita Falls, Texas, but of Oklahoma City and Omaha and Lincoln and Atlanta and everywhere else really in the United States. We tend to be interested in what's happening locally, but really this pandemic is a global phenomenon, and paying attention to the global implications to trade and to global economics and to political situations in other nations that can quickly become a problem for us. I think that needs to be part of the community conversation across the country. Well, what is the scientific community doing about COVID-19? And to address that question, as of November 23rd, I went to the University of Nebraska Library's Biosys Citation Index. And this is an index that publishes titles and abstracts, when available, of all scientific papers published going back to 1926. So I did a search using keywords SARS-CoV-2, which is really the sort of virologist name for COVID-19, and COVID-19. And I asked how many scientific papers were published in 2018 and 2019 using those terms. And the answer is 1. That's a paper in a Russian medical journal about the in vitro effect of Kagocel, which is an interferon stimulator. However, 2020 is very different. So during 2020, if you do SARS-CoV-2, 6,244 papers, and COVID-19, almost 11,000 papers have been published globally, using on that subject. Well, you can trash science all you want, but you don't get into that index by posting your opinion on Facebook or sitting on the sidewalk with a cardboard sign. So what you're seeing right there is and if you read those abstracts and those titles, there's a staggering amount of very sophisticated molecular and immunological research going on all around the world on this viral pandemic and the virus that's causing it. So what you're seeing is really science's efforts to expand our island of understanding in that sea of ignorance. And as you should know, as that island of understanding grows, and this is actually, I've taken this straight out of MacArthur and Wilson's island biogeography work. As that island grows, the boundary between what we know and what we don't know gets larger. So this is the reason that the main product of science is really questions and problems. And also the island itself gets more complex, as you can see by the geography. And so by more complex, when you look at those 10, almost 11,000 papers, you will see the diversity of research that is going on, and that's then modeled really by the diverse geography of this island of understanding. Well, I'm not a virologist, but I am a biologist, and I'd be happy to try to answer any questions you may have. There's no guarantee that I'll be able to give you a definitive answer, but I'll give it a try. Thanks.